Hi, I'm Dr. Yi-Ren Chen, and I'm a spine surgeon at Mercy San Juan Medical Center. Today on Ask the Expert, we're breaking down spine health, why it matters, what symptoms to look for, and how modern, minimally invasive techniques are improving care. Let's start with the basics. Why the spine plays such a central role in your nervous system. The spine is unique in that it's a combination of orthopedics and neurosurgery. Both orthopedic surgeons and neurosurgeons can intervene well on the spine. The spine is made of building blocks, the bone, that hold up the entire body, but immediately around it are neurologic tissue, all the way from the brain through and near the spinal canal, and they supply the entire body, arms, legs, organs. So if you have symptoms of numbness, tingling, pain, or if you have issues going to the bathroom, a lot of times that's a result of spinal issues, and it's important to seek care. Because the spine affects so many parts of the body, symptoms can show up in a variety of ways. Common symptoms of spinal issues are neck pain, upper back pain, or lower back pain. But some of the other warning signs include new numbness, tingling, weakness, or even bowel and bladder problems. That's actually a spinal emergency. So if you have any of those symptoms, you should contact your healthcare provider. There are several kinds of spinal surgeries available depending on the presentation. However, we always recommend starting with conservative management first. A lot of symptoms from the spine can resolve with time. That includes back pain or even sciatic symptoms. Starting with physical therapy, pain clinic for injections, or medication is always recommended. That being said, if patients fail conservative management or there's a more emergent situation, then there are several spinal surgery types available. The first kind is a minimally invasive decompression. We make an incision just about a ½ inch, then we put a tube down, and then we can decompress the spinal canal. Patients usually go home the same day. If a stabilization or a fusion procedure is needed, there are also minimally invasive options, including with an incision, either 1 or 2, and the spine is stabilized that way, and patients can also leave either the same day or the next day. For more severe problems, such as with scoliosis, if people cannot stand up straight and they have a lot of pain, there are more extensive procedures that can be done to straighten the spine out and remove a lot of the pain. To know which approach is best, we rely on the combination of detailed exam and advanced imaging. We always start with a detailed history as well as examination, checking each body part or the strength as well as sensation. After that, there are different modalities ranging from X-ray, CT imaging to MRI, where we can precisely look at the bony structures or the neurologic tissue. If there's more nuance that's needed, we can do this EMG nerve conduction study, and that's where we really test the nerves to make sure that the symptoms are coming from a spinal origin. These technologies work best in the hands of an experienced specialist, and that's where Dignity Health's spine team stands out. There are 3 things that set Dignity Health apart as a leader in spinal care. The first is that we focus on minimally invasive spine care. We try to make the smallest incision possible, both in patients that need fusions or not, in order to help patients recover faster. The second is our focus on scoliosis and complex spine. For patients who have trouble standing straight, either leaning forward or leaning to the side, who have a lot of pain, we're able to restore their spinal alignment and get them back to an active and healthy lifestyle. We also specialize on complex spinal care for people who have had a lot of surgeries, their 5th, their 6th, their 7th spinal surgery, and are still in pain. If after workup there are still issues that can be addressed, we're able to address them and get them back to an active lifestyle. The most important takeaway is to remember that the spine is the foundation or pillar for the body. All the nerves in the brain go through the spine and into the rest of the body. If you have symptoms of very severe or persistent pain in the neck and the back, or if you have new numbness, tingling, and weakness that's persistent, it's best to seek care as soon as possible. Early intervention or early treatment portends to a better outcome. At the end of the day, your spine is essential to your overall well-being. We hope this helped make spine health a little clearer and showed how early evaluation and modern treatment can make a real difference. Thanks so much for watching Ask the Expert.